Welcome to the Compromise to Alchemized podcast, and I'm your host, Dr. Neil Bolton-Donnie. I'm excited as you join me in this journey to listen to my conversations with some of the leading experts in the field of healing from a broad range of disciplines.
All right, so I'm happy to welcome you to the Compromise to Alchemized podcast with Dr. Neil Bolton-Donnie. That's me. I am sitting in Santa Barbara, California, in the office that I work out of. Nicole Cantello, the RDH and myofunctional therapist, and she is blazing quite a path in her current career. And we will talk about that sometime in the near future. But today I wanted to talk to you about this interview that I did on Kelly Dean's Tummy Team podcast. We had such a great conversation. I was quite enthused about being on her podcast. So since this was her podcast where she interviewed me, we just figured it'd be good to tell a little bit about it and sort of explain how it came about. But I think we go over that in fair detail in the actual interview. So if you don't know Kelly, so what happened is I think I tell it in the interview, but I was Googling looking out for more people working on diastasis, which is separation of the abs. And in particular, I was looking for more people who were working on the ab separation that comes from origins or reasons apart from moms who have had babies and even some surgeries. So babies and men who've had diastasis. So, and of course, I know there's a great article at Stanford that talks about this. And but then you come across Kelly, and she's got a lot of great courses where she talks about this, and she also does like virtual appointments for this. So I was just so happy that I reached out, and as I do, I was just saying, can't believe you have this content. I'm so excited, and also, hey, let's talk. Or would love to just even catch up. So we did, and in short order, we were both so kind of inspired. So we're like, let's just let's see what this looks like. And anyways, we definitely talked about the way our work is very complementary. In one way, we both work similarly. Actually, in so many ways. One, we both have virtual appointments. I have in-person, and she's a physical therapist and works with the body, and so do I. So she has some, and she'll go into her origins. And in fact, of course, I'd love to talk a little bit more about her. She was focusing on me, but she has her origin with concussion care, stroke care, helping patients heal from that, and then ended up in this route of helping with diastasis. This diastasis is another way that it's pronounced. Diastasis recti abdomini, and that means the abs separate, and that means the linea alba is compromised, and that means the so many things are, what happens as a result of that, right? People have lack of core strength. People have an inability to hold the posture through what the abs would normally do. Of course, you're talking about less ab strength, but it's not always inferior ab strength. In fact, some people with diastasis, they're actually quite strong, but there is something in particular that can happen with that when the abs don't hold their optimal alignment. I talk about the abs as being a container or part of the container of the visceral structures, the organs. So I tend to see people have way more of a likelihood of organs being misaligned, and then it's hard for them to stay aligned. So I definitely wanted to highlight that part, but you'll hear it. We get into a lot of good conversation about diastasis. And, Kelly's definitely got quite a journey too of how she came about her work. And I think we both follow intuition. And I really admire that about her work. And as she talks about it, it really reminded me of how some of my protocols came about with the floor of the mouth and some of the other protocols that I use in my clinical practice. So I loved it. It was so cool. And I think it's going to be fun to see what you all think. So I do want to mention that in this, as if you've seen her content, you've seen her posts, you'll see that I'm offering tongue press, and I'm really excited to get it out there at a new level. And so yeah, so I'll kind of for sure I'll allude to it, but I'll also talk about the floor four. And so I think we're gonna have like tongue press is gonna be getting that out there so everybody can grab that. And if you haven't had it, or if you know somebody that you were talking to about it and you think they should get it, get it for them as a gift, because I'm going to be offering a coupon code. And in particular, the one for this podcast is it's tummy. I think it's tummy team 20 or tummy 20. So you can get it for $20. That's huge. And more than that, just keep listening. I'm going to be putting out podcasts a little bit more frequently. I've got this amazing team that's come around that's helping me more with that. So, let's just see what you all think of this. Tune into my Floor of the Mouth tour. You'll all see some more info coming out about where I'll be. I just want this to be a great time of exploring this pivotal topic. Who isn't this relevant to? Because there are a lot of babies, kids, and men who grew up without having their abs cohered or come together. And of course, the women and the moms who have had babies. This means it can affect so many areas. And of course, one of my main areas that I talk about is the floor of the mouth. And I say that if we're talking about ourselves, or if we know others, or we're guiding other people in healing, and they're going into any procedures, if they're just trying to get well, then if also they're trying to get well and then they're doing, any kind of healing for their TMJ, or you could say pelvic floor, or you could say headaches. And of course, we could talk about so many things, but I'm going to focus on if they're dealing with any tongue tie issues, if they're dealing with palate issues and they're getting expansion done, or if they're going to any process like that. If they're getting body work, if they're doing movement, if they're trying to get well, if they have an undiagnosed diastasis, it will be so pivotal to have it properly assessed. So I'm not going to go over that in this. We will definitely be talking about that more. I have a feeling we're going to be getting some exciting things together to present a more coherent, relevant sort of exploration of this topic. But for now, listen in. You'll enjoy it. I've definitely taken enough time for the intro here, as I'm new to these, and hope you enjoy it. Listen, watch. Please, just have fun. And I'm excited you're here for the journey.
Hi, everybody. Welcome back to the Tummy Team Journey podcast. This is Kelly Dean, your host, and I am super excited to have kind of a new connection, a new colleague that I have just started to getting to know, Dr. Neil Bulchandani. And Dr. Neil works in the floor of your mouth, which is going to seem like, what are we talking about here on the Tummy Team? But you're going to see how all of this is connected. We're going to talk a little bit about diastasis and tongue tie and kind of everything that's connected between the two. And I think it's going to be a fascinating conversation. So thank you so much for joining me. How are you doing, Dr. Neil? Can you tell people a little bit about yourself?
Yeah, thank you, Kelly. It was awesome to connect with you. And I'd love to start with like how
I reached out because I was like looking around, and I'll tell more about the context of this. But as a practitioner who works a lot with people, whole body, and investigating is everything, especially the mouth, but how it connects to the whole body, like you said. And I've been working with diastasis since I started working with you know um, pregnancy and postpartum. Then
Mm.
and then I started to see it on babies and men, and I was like, wait a minute. Why do I not know about this? And I think you went down this rabbit hole a long time, ago. And and then I looked up things, and so I've got a couple things. Like Stanford has a great article on diastasis in babies. I'm like, way to go, Stanford! But there wasn't. I was looking for extra things to give my patients, like
Mhm.
beyond me, right? Because I want them to have other resources. And it was like not too long ago that I looked you up, and I'm like, oh my god, this is amazing. Kelly's rocking out so much info. And of course, I looked at your links, and I'm like, this is for men, for babies. I'm like, here we go. Not only does this person know about this, but is an expert in it. And really, that's what like made me want to reach out to you and just find out more like about you, and then also just share, because I've been like, for me, it's such a pivotal area of the body. Like your people are going to be like, of course, this is like what you all talk about. And for me, it's because I work with babies to adults. I see across the lifespan how influential that area of the body, not just the abs, but that core area is to so much. And so, yeah, so I really was drawn to your work because of that. And then I watched some of your podcasts. And so I'm like stoked, excited to be on it, getting to talk with you about our shared kind of work there. So,
Yeah.
um,
Yeah.
yeah, if I give like the 1 minute version of who I am, just so people know,
It's
yes, I'm a,
so hard, right?
yeah,
It's
yeah,
so hard. When people ask you what I do, I'm like, I have like the 1 minute, the 3 minute, and
yeah,
then like 15 minute if you really want to know. But
yeah.
we'll go with whatever you can want to give us.
I'll do like I'll do the hour. No, I'm just kidding. I'll do the 1 minute. I'm a chiropractor, yes, but I quickly delved into and been practicing for 17 years. Graduated from Palmer College of Chiropractic in Davenport, Iowa. Born and raised in Illinois. Now I live in Santa Barbara. Yet I'm in the Bay Area on a work trip, seeing patients here. I'm a specialist in airway and feeding, all ages, but of course I help babies with breastfeeding when they have a tongue tie or any narrow palate issues or just tension in their whole body. And then, of course, I love helping the moms in that dyad relationship. But I also just help kids to adults. And a lot of them by now know they have airway issues, or rigidity issues, or any of these things that are related to tongue tie or narrow palate. But some of them don't. They just come because they hear I do this like somatic transformational body work that gets at the root of things. And so that's kind of what I'll say. I know I'm in like 2 minute, but I'll go another minute to do my 3 minute version. Is um, quickly, I delved into fascia and working on organs and working on cranial bones, things that were outside of my training that I got at chiropractic college. And I trained with the best in like a couple techniques in the world, but they didn't touch on those areas that I just mentioned. And I started finding things like people getting healed of concussions more quickly, and people, not being able to swallow, freeing that up, and they could all of a sudden swallow extraordinarily better. I didn't even know what I was working on really until later. Um,
Mhm.
so it was like 17 years I've been in the field, but it was 9 years ago, when my daughter was born, oldest, with a tongue tie, that really threw me in deep into that field. And that's what started like the aware journey that I've had with helping. Although I saw moms before who had
Right.
pregnancy, postpartum, and I saw babies before, I didn't really see them, right? I didn't know this issue. And when my daughter was born with that, and our midwife said, "Your daughter has a tongue tie," I'm like, "What? What is that?" And what is that? And
Right.
pretty quickly, within days to a couple weeks, we saw the extraordinary struggle of that issue, ankylosing and tongue tie. But also on the other side of that, we had some people around us who could tell us, yeah, look into this and do this. And I did what I could, and I, referred to other body workers. And that story is longer. So I'd love to go into that if it makes sense. But I think that was what really threw me into delving into this mouth body connection. And inevitably that led me to one of the reasons why those don't work when we're working with the mouth and with the body. And so I started to see other things, certain organs when they're out of alignment, when people go in certain positions, they don't, it takes a lot to get them to stay aligned, like a kidney or thyroid gland. Then I started to find, oh, when there's diastasis, it complicates things. It throws the body into this unstable pattern, and the container of the abdomen can't hold organs in their proper alignment up and down. So I started to really diligently resume working on that on all ages and, men, women, because I started to see, oh, that's why the tongue tie surgeon referred this man to me, because he went in for a tongue tie release because it was really what he needed, like 28 years old. But, um, but at the same time, he was really going in for nervous system dysregulation, for pelvic floor issues, and for bladder control issues and nervous. That's why he drove him to find out that, oh yeah, the tongue tie release might help with that, but it didn't. It released his tongue, and his tongue could move more properly, and his body got a teens looser, but he still had all the other issues. And the surgeon referred him to me, and I quickly, in short order, was like, oh my, he's got diastasis. It's pretty significant. He's got both kidneys anterior out of alignment. No wonder he can't regulate his nervous system. So after our first session, he went from ultra rigid, ultra dysregulated to a little bit more regulated and less rigid. And he said he could feel some kind of suppleness and malleability, not just in his body, but in his nervous system. And we had a couple more sessions that helped out more. But that was also a few years ago. That was an eye opener on like men with diastasis. I'd seen it in
Mhm.
babies and with kids, and I just, it's one of those things where now that phrase, you can't unsee it. Once you see it, you can't
Right,
unsee it. You can't
right.
unfeel it. I'm looking for it everywhere. It's not on everybody, but I mean, a whole lot of people got this issue going on. So
Yeah.
yeah,
Yeah, I love there's so many things I could pull out of that, but I do feel like when it hits home personally, whether it's on our own body or our loved ones, our kids or a family member, it really does change the trajectory of our focus and our career ultimately. Like when there's a personal connection, and that's how I mean, I didn't do this work. I was a brain injury and stroke specialist. And then, I had a six-finger wide diastasis, and the support out there was really poor. And then I started talking to my friends, and they all were suffering from the same thing. And I just felt like, I couldn't not keep learning about it. But like what you said, once you see it, you can't unsee it. And now it's like, okay, if I don't know, like people will come in to see me with like this laundry list of really complicated, obscure, somewhat things. And I was like, okay, there's a lot going on here. And I could get really distracted by that, or I could be like, okay, let's at least look at what's going on with the core first. And I'm sure you probably look at some key things that you look at, right? I look at diastasis and posture, and connection first. And I'm always like, if I can correct that, then let's see what's really going on. And I love the other thing that I love that you shared was that this the core is a container for our organs. And I have this really big pet peeve of physicians telling people that diastasis is a cosmetic issue. It's a cosmetic issue. You can get plastic surgery, which is an elective surgery, which I don't want people to get surgery anyway. I'm glad they're not saying let's just do surgery. Most of the time they're not saying that. I don't think that's the solution, but there are no solutions given to most people. It's kind of like this is a natural byproduct of pregnancy, or in men they say weight gain,
right.
or babies or kids they say it's normal, they'll outgrow it, or we'll look for a hernia. If there's a hernia, we'll repair it. Otherwise, you know, it's just a cosmetic thing to live with. And the fact that our organs need to be in everything in our body as an optimal alignment for it to work well, um, and that's where posture comes in, but the core helping hold the organs in the right place. And, I often am looking at bladder and uterus, those kind of organs, so they're not like dropping out of the pelvic bowl. But there's so many other organs in there that need to be supported to be functioning well. It, just sheds light on the fact that this is not just a cosmetic issue. This can make people not feel well,
Yeah.
and not function well. So when people are like, my stomach, it doesn't look right. I have this coning. I've been diagnosed with a diastasis. It's been kind of dismissed by most of the medical community. And I feel all of these things that are kind of nebulous, hard to self-diagnose, because they're not just like, I have this pain or I have this, dysfunction. They're like this more obscure, like, I don't feel right, or they haven't felt right or functioned right. When you say neurodysregulated, they haven't functioned right for so long that they don't even know what they're missing.
Yeah.
And when we give them something back, and I bet you experience this as well, when they get it back, there's just like this light bulb that turns on. They're like, "Oh, I bet you that's how I'm supposed to be feeling." You
Yeah.
know, like,
Yeah.
right?
Yeah.
And and so I love how you kind of I love how you got into this, and and then kind of it probably snowballed a bit, right? You're
Yeah.
like, "Oh, what about this? Oh, what about this?" I also love what you said, and I've experienced this so many times where I didn't really know what I was doing. Like there's like this intuitive, I'm pretty sure this needs to be fixed, and let's try to get this back to how it's, the original design is how I talk, how the original design of this body was supposed to, let's get it back to that, and then let's see what happened. And then I will sometimes backtrack and kind of put the pieces together of why it happened after we resolved whatever was going on. And then I can go like, oh, I know now why it happened. But while I was treating it, I didn't predict like the steps that were happening to treat it, if that
Yeah.
makes sense. Right? And then
Totally. I
once you've done it,
love
you're
it.
like, "Okay, next time I know exactly that this,
Yeah. Well, I
you
mean,
know, the
that's
trait."
the mind and the sign of an innovator, and also not just an innovator, because like sure you are, but it resonates because like you're also looking at each person as who they are, not as just like another person in another case. Everybody's different. And I say this too to some people. I'm like, you're different than the last person. And you're also different today than you were the last time I saw you or the next time. We change every day and we have circumstances, and not just in the external environment, but we have the emotional terrain and
Yeah.
trauma, and that can restructure our being and our bodies some. So I love that. Yeah, like I use words like I see like intuition is one of my best teachers. Like the following that flow and following intuition, and then later I'll look back and I'll reverse engineer what I
Yeah.
did, right? Because it's like I don't know what I'm going to do until I see that it works, and when it works, and when I know that this is fruitful and we're actually seeing things, that's worth going back and
Right.
repeating and figuring out. So I'll say to people, they're like, "What do you think I should do for this and this at the beginning of an appointment?" And I'm like, "Good question. I have no idea." Because even though I've seen that condition a million times, I don't know what led to that issue, and I don't know what's going to unlock it for you. So let's figure it out together. And then at the
Mhm.
end of this session, hopefully, I'll give you a couple things
Yeah.
that, and then even better, the next time I see you and I hear how you've been doing, and I hear like, ooh, what worked, what didn't work, I check you and I assess, as long as it's like within, a few days to a couple weeks or so, or a few weeks. Then I'm like, then I'll see what worked from what we did. And then I'll know even more what to give you as a recommendation. Because I do, I love to give what people can do at home. What can they do in order to elicit change more? Because I want people to rely less and less on me and more on their intuition, more on their own agency, and more on
Yes.
just time and money too. It factors into this. So yeah, I love
Yeah.
that the way you said that. It's like um you kind of, well, you kind of like, yeah, you remind me of me in that way of like, and you you like look back and you review. I have had days where I'm like, oh yeah, I was just following in a flow. I didn't think much about what I was doing, but I knew I was in a flow, so I could trust that versus just like not paying attention. That's a big difference, right? So, but I followed my body, followed the intuition, and it was like when I look back, those are like really pristine, pure moments tend to happen at like along the way, and they're like, and then when I reflect on those times, I'm like, that's when I'll figure out one of my protocols because by now I think there's a lot of great work out there, and I really appreciate that, but especially when my daughter was born with this tongue tie. Well, the crazy thing is, you mentioned this too. You said when something happens like to a loved one, or you have like your journey with yourself, like that's what really marks you. Well, even though my daughter's tongue tie was that provocation, I look back and the year before she was born, I was doing intuitive movement, wake up, and I used to do that in like undergrad. I was a dancer, interpretive movement. I was a raver, but I left that lifestyle behind, and I got into more like following those dance interpretive dances. So, anyways, the year before she was born, I was led to go back into like that flow of early morning movement meditation. And so what I realized is that whole time I was doing a lot of um, movements and things that loosened the back of the floor of my mouth. And I had no idea I was doing it. But when I would teach people how to do it, because I taught my movement course after that for a while, I would show people moves and postures and positions that would get the back of their throat and the inside of the floor of the mouth to stretch. And I went through a year of doing that, and after doing that movement, it was whole body, but including the mouth, not putting my fingers in my mouth, just moving my tongue, and I hadn't had any training. I didn't even know tongue tie existed because I have one as well. It was after that year that I got freer and stronger in my body, and I've had way less injuries, way less a need for chiropractic, way less a need for a lot of things. And then she was born with a tongue tie, and so I didn't
Yeah.
realize it until later. The other thing is I did a lot of body work on my abs. I would just go at it with gentleness, but also depth. And I was running and doing a lot of, fun movement like that. I look back and so because I rechecked myself a few years ago, and I'm like, oh, no wonder I had the weakest core. I couldn't sit up. I felt like I was collapsing, and I always looked at myself as this weak, inadequate person growing up, and that was one of the things. And so I realized that I had done body work on myself to help my diastasis, and I had one body worker work on it um, years ago. But she was a Chinese massage therapist, trained as an acupuncturist in China, and then came over to the States. She didn't tell me what she was doing, but she was working on the abs. And I remember after that, I had so much better like function in my gut, and so I also feel like I the diastasis part for me hits really at home because that's also been a big improvement in my own health. Is when I started to feel and look back and I realized, oh my gosh, I was addressing that and I had help with addressing that when I didn't even know that's what an issue that I was born with as well.
Yeah. Yeah. It is fascinating. I like how you say reverse engineer, like, you can go back and you can look back and see how things fell in place to get us where we are to do this work, because I'll have new therapists that wanna shadow me or wanna work with me, and, it's so like, I totally invite them in because there needs to be way more workers, but there's not this. I think everybody's on their own journey, right? And, like, sometimes people can't. I can kind of go back in time and go like, okay, these are the steps, that I typically take with most clients. I don't really do protocol, but there is a pathway, right? There's a
Yeah,
clinical
yeah,
pathway. We look at this, then we look at this, and then we might go this way, or we might go this way.
yeah,
And but it's really hard for somebody from the outside to learn it. Like, learn it the way we learned it.
yeah,
So it's easier for me now to have this clinical pathway and to explain why everything worked, but I didn't have a clinical pathway. I created the clinical pathway after
yeah,
years and years and years of seeing people over and over again, and starting to go, okay, there is there's a typical connection. Not for everybody, but sometimes we have to go off. And I also do what you do, where I say, with clients, let's talk about how things have been going, what's worked and what hasn't worked. And I love presenting it that way because I think it takes off the pressure for people to feel like like if something's not working for them to feel like, oh, I didn't do enough of the exercises or I
Right.
didn't do something right, when that might not be the case at all. That like this, I know that this exercise or this posture or this thing I want, this stretch, this release I want them to do, I know their body needs it. But if for some reason it is not working in their lifestyle, there's resistance in their body, there's some reason they're not doing it, I never want them to feel like that's their fault. My job is to give them something different that's going to be more effective, even though I knew that thing would work if we could get them to do it. But for whatever reason, it's not working. And and it tells me like, how is their body feeling? Because once I resolve one thing or improve one thing, usually it wakes up the body to realize all these other areas they've been compensating, right? Because the loudest voice is the one you hear, right? So the loudest symptom is somewhat distracting us from really maybe the deeper, more foundational symptoms. And then we can kind of go from there. So yeah, we could talk about stuff like that all the time, but I want, because most of our listeners I think are clients, not practitioners. So I want to have you explain a little bit what tongue tie is. And even just that term floor of the mouth, I think that, helping people to understand, I think people that maybe moms that have babies maybe have heard it, but I think it's really an underserved population, and people don't realize that when we were babies nobody was looking for it, so you might be an adult that's still struggling with this, and what does that look like? I know that's a huge loaded question, but good luck.
Yeah. Thanks. Good luck. I love that. You're like, good luck, Neil. No, I love it. The way you're talking, I'm like, wow, we think you're a different person and you're brilliant in your own way, not just like me trying to make it seem like we're similar in too many ways, but the way you think, I see it. I'm so like parallel. So um yeah, I'm intrigued to know how we might collaborate because I can't wait to like just the conversation's so fun. And for context, to jump to the diastasis part and then back to tongue tie,
Okay.
I'm teaching my floor of the mouth, which is totally like the way you talked about what you did and how no clinical pathway. I'm like, a lot of people, I've had amazing body workers who have, they work in the mouth and they work on the body, they work with tongue tie. And I love and respect so many of them. But as for what I've done with the floor of the mouth, that's subtly different, yet I've seen it work crazily. And that's why kind of I'm putting that out into the field. That there wasn't any work out there that covered that terrain of the floor of the mouth in that depth. So I had to just see what happened, and then later saw and I figured out through the algorithm of the patterns I was seeing in my notes on everybody. I'm like, whoa, I'm seeing this pattern, and I'm seeing these 70 areas in the body, muscles, fascia, bones, and organs that are restricted in certain vectors when there is a tongue tie, when there's a narrow maxilla, palate, when there are these, issues in the mouth and with airway and sleep and et cetera. And I'm like, that's what it was one of those, once you see it, you can't unsee it. But I didn't, I had to create that, make the map of the body, and then start teaching that map. And when some people look at it, they're like, why is that connected? What's going on there? So it is, I have to like go, okay, yes, if we go back to embryology and the way we form in utero, and I'll just explain some of that. And then I'll say, and then there's where fascia comes in. And then people are like, oh my gosh, that makes so much, the aha moment when somebody comes in and they realize that, like, you
It's all
mean
connected.
my tongue tie was creating my calf muscle tightness? You mean the tongue
I
tie
was
was
just thinking that. I was thinking, how many people do I have come in that have a diastasis, and I'm like, "Oh, we really need to release your calves." And they're like,
yeah.
"My calves?" Or "Do you sit this way at work?" "Yeah." Or do you they have some symptom, I was like, "Oh, do you always carry your baby on the right hip?"
Yeah.
"Yeah." Like, it's like, yeah,
Yeah.
yeah.
They're like, how'd you know? And I'm like, well, your body is just clearly telling me that. And they're like,
Yeah.
okay. And then I explain, I'm like, well, and I explain it, and I'm like, okay, and I could say all these words, and I could tell you all these words, and some people are like, I don't know, I don't even know what you're saying, and some people are like, tell me more, and I'm like, let's put pause on the conversation and let me just show you. So then I'll work in the mouth, on the
Mhm.
body, in the mouth, on the body, and sometimes within like 5 to 10 minutes of working, we get the body to unlock the mouth, and then once the mouth, the tongue, and the floor of the mouth loosens, which I'll explain, the whole body goes into this diffuse, overwhelmingly freeing state where the calf muscles that are rigid turn into butter. Those inner thigh muscles that were rigid turn into elastic, flexible muscles. The trapezius muscles, which were rigid, loosen. There's these are some of the 70 areas.
Right.
Even like some of the cranials and some of the even the left medial bicep will free up because that's one of the points on the map. It's crazy. So usually I'm like, okay, and then the lip muscles will elasticize, and they're like, oh my gosh, like, and I'm like, yeah. So words don't really characterize this. Once you feel
Right.
it, then you're like, oh, whoa, what just happened is what people say. And some people, like, their eyes get so wide, but yeah,
Mhm.
it's that feeling of like, that's the physical feeling. Some
Mhm.
people are like, oh my god, they start thinking about their life, right? Like you've had people with you, and they start to frame their life in reference to this issue. And I think some people do feel like that's overwhelming. I had somebody who flew in from New York to get body work, and she realized that for like her whole life until 35, she has been dealing with all these issues in her abs and core, and she thought she was weak. And she said, I'm just getting old. And I'm like, you're not getting old, you're 35, but you feel it. And
Right.
part of the diastasis has been a big part of it because she had her tongue tie release, she had expansion from the best in the world, right? But the diastasis was never addressed. And I saw her and I'm like, this was a missing link, right? This was a missing piece. So once I worked on her, she was still in shock. She's like, "Oh," she's like, just those moments that I had this issue in that." And I think she also felt like the invalidation of people, like, and so I think people have gone through that where it's like shocking and overwhelming. But usually on the other side of that, or in the moment, they're like, that so validates what I've been through and what I struggled with. And now I know that there was one or a couple things, not just a million problems. And
Yeah.
I can do something with that, you know? And I feel like you've had that experience, I know, countless times. So it's just such a good feeling when you see people being met, feeling known. But then,
Mhm.
yeah, like, okay, there's actually a pathway. There's a possible pathway towards healing if we just travel down this path a little bit. So in the sessions, I'm like, sometimes it takes longer to figure it out, but when we get to that point where the mouth frees up and the whole body starts to experience change, and then I'm like, okay, now we actually have access to your body. Now we can work on your body. And they're like, but I've been getting massage and body work and this and that, and it's helped some, but yeah, it's never really done this. And I'm like, because we didn't, like, your body needed this to get access to it and to get into a place to where it actually made sense to it in its brain and its body. Um, and I love the diastasis part of it because it's a huge part. Organs being out of alignment is another huge part of it. And because a lot of people, when they come in, they're like, I know my son has a tongue tie. And of course, if they're like 2, 3, 4, 5, 6 years old, they're like, I didn't do anything when the baby was a baby because it was breastfeeding was fine. And then now I'm seeing issues and it's probably that. And I'm like, maybe. Yes, there's a tongue tie. Yes, there's a lip tie. Yes, there's narrow palate. But is that really the issue? And then sometimes when I find diastasis, like this amazing body worker who I collaborate with in the LA area when I was worked on her son. I think he's 4 years old and 3 years old. Worked on his son, and he's had really phenomenal body work from her and others. And I saw, oh, his diastasis was there. And I worked on his abs, and he stopped wetting the bed. He stopped wetting the bed, and that's been for a long time since he'd always wet his diapers, whereas he wouldn't wear diapers during the day. So she just kept texting me. She's like, it's another night, and it's no wet diaper, and she's just like, oh my gosh, that's amazing. And I think that's like sometimes at the crux of this is that people come in thinking it is the tongue tie, and I think it is at the root of a lot of problems. But I'm like, yeah, and what? Or what? But
Mhm.
yeah, to explain the tongue tie, so everybody has a frenum or a frenulum. That's the word for the tissue that is under the tongue that we often say is tied. But we also have an upper lip frenum, a lower lip frenum, upper cheek frena is the plural, and then lower
Mhm.
cheek frena. So we all should have 7 frena. That's normal. But what is different is that if those frena, if there's too much tissue there, and if it's too rigid, then it's called a tethered oral tissue or a tie or
Mhm.
a tether. And technically, the tongue is called ankyloglossia because the glossia is the tongue. They're all important. Any restricted tissue is important, and when that happens is 4 or 5 weeks gestation. So, like for people who go 40 weeks, to full term, the problem's been there for 35 weeks. So they've been sucking and in utero, sucking and moving with that restriction, and that's one of the reasons because when the tongue is tied, then the muscles under the tongue, which normally when you lift the tongue and the frenum can stretch easily, well, the muscles don't tighten. But when there is a tongue tie and the tongue lifts, well, that tie is too rigid and it brings the floor of the mouth muscles up with it. That's called a compensation for a tongue tie. There's a group of muscles called the mylohyoid muscles. That's what the floor of the mouth muscles are. And then there's different names for those muscles. I won't get into that because I always just say the floor. It's the floor of the
Right.
mouth. And
Kind of what I
um,
say with pelvic floor muscles. I was like, it's the floor of your
yeah,
core, because a therapist might need to know the individual muscles. The clients don't.
no,
They
I've
it's
seen,
too much.
too much, and even a body worker or a healer or a dentist or whatever. When I'm working on them, they're in a different state of receptivity. They want to get like feeling healing, and they don't want to
Right.
like they do want to know a lot. But I'm like, you could want to know all this, but why don't we save that for later? And why don't you just like experience this? And so when those floor of mouth muscles are lifting and raising up, people say, well, but what's the problem with that? And it's like, well, it creates tension not only in the floor of your mouth, but it pulls up the scalenes and the SCM muscles. And yeah, there is this, this front line of fascia that's often talked about, and we can credit Rolfers like Ida Rolf and then Tom Myers with anatomy trains. These guys, they did really pave the way for an understanding of fascia. There was others before and others after, and
Mhm.
I think that's a relevant like thing. It's like, yeah, fascia on the front of the body just stiffens, and that connective tissue just pulls all these things into tension. And well, because if the tongue can't move easily, yeah, it could create problems with getting that proper motion up to the palate, which is important for breastfeeding or bottle feeding. But it's
Right.
also important to breathe. That's just to get to the tongue to the roof of the mouth is the first step for nasal breathing. And we want to breathe in through the nostrils because the nostrils humidify, detox the air. And, of course, there's separate issues if there's nasal restrictions, but that tongue getting to the roof of the mouth is not only the most important thing for feeding and for breathing, but it also our palate is like the home for the tongue. And so there
Mhm.
is part of our nervous system and our like tension state that is influenced by that. And when the tongue can get up there and rest there, and some people are like, I am getting my tongue to the roof of the mouth, maybe. But if you have a tongue tie or a lot of myofascial restrictions and just tension, the back of the tongue is what has a hard time getting up there. And that's the part where people are like, oh, I didn't realize I wasn't getting the back of my tongue up there. Most people know what an anterior tongue tie is or have seen one when
Mhm.
that frenum goes to the tip of the tongue. And it's like, yeah, it can be more likely to cause speech issues and but there's a whole different realm of issues that a posterior, or what's now being more properly called a mid tongue tie, when the frenum goes not all the way to the tip, but it might go halfway or this way, and it's too rigid. Well, yeah, the front of the tongue can get up, but the back can't. And that can create a lot more symptoms because the back of the palate is really important for getting the cranial bones to move well. Because even though the roof of the mouth is in the mouth, they're actually cranial bones. So when those cranial bones don't move well because they lack that pushing up pressure from a tied tongue, well, then the cranial bones get stuck and rigid, and then you have more headaches or migraines or nervous system dysregulation. Hard to get like ramped down from stress, or hard to feel settled or safe sometimes when there is stress. But our bodies were made to be resilient, so it's really amazing to see what some of this work. But I'm just thinking of like one other example that might be good. And let me see if I. Well, let's just say like that when I get on the when somebody gets on the table and and I'm going through, like, I'm like, okay, yeah, I see you do have a tongue tie, and I'll walk them through that, and a lip tie, and upper cheek tie. It's really common for, if there is a tongue tie, usually you'll see a lip tie and usually an upper cheek tie on, four ties. Sometimes
Mhm.
people only have the lip and the tongue. I've had so many people come in and they're like, no, I've been seen by three or four people, and nobody, they said I didn't have one. I'm like, once we worked on it, I can now see it. And sometimes body work can reveal a tie more easily because it takes those compensated muscles and fascia out of the picture more easily. But I think something like that I really like to talk about is like the sometimes it is like, oh yeah, if the kidney's out of alignment, I'll loosen it, or the diaphragm, I'll work on it, and then the thyroid gland I'll work on. Then that's what causes the floor of the mouth to loosen. Because usually the organs being in tension cause rigidity, and but sometimes it's an emotional thing, right? So like somebody who was on the table who remembered, because I said, yeah, the word perseverance is coming up, and was there a time when you felt like you really had to struggle, age 3 or something like that? And what about winter? And she recalled a good memory of when she was 3 and the sledding. But then she's like, oh yeah, but I probably was freezing, and I think I was mad. And she remembered that. And it was after remembering the anger that the floor of her mouth loosened. So I really get into like working in that multifaceted way, because we are complex beings, and our emotions affect us and they affect our tissues. And sometimes we don't need to talk about our issues, although we do need counseling and therapy and all that. But sometimes we need to release those tissues and the issues come up with it. And I love that. So, um, yeah. And then there's a whole separate thing when we have a narrow palate. And then there's other things to talk about with that. But altogether, they fit into that category of things that happen at 4 or 5 weeks in utero. And when that
Right.
happens, it sets this domino effect that, is there. So I've seen like babies, mom to bring the babies in, or dads, and then yeah, and then I'll usually always end the session with teaching the parents or parents how to do body work on their baby, and then I'll usually demo in the parents' mouths to show them what it feels like, and then I'll say, "Yep, and you have one. Oh yeah, maybe you do too." But when I get to see the grandparents, then I'll find it sometimes on them, and then I've had the pleasure of having a great grandparent in the room also. Then I see it on them, and I see like, whoa, this goes back pretty far, and yeah, it used to be said that the tongue tie is 2% of the population has it. And I would say those of us who are in the field say has seen that it is ramped up. And I think it is more a combination. Yes, we're spotting it more. But yeah, it's like, whew. And some people wonder like what's causing it. I'm like, yeah, there's no consensus. Some say it's vitamin A issues, some say it's folic acid, some say it's MTHFR, methylation. I just think there's too much possibility. But the problem is, and then there's the anthropological concerns. Like sometimes people are like, because James Nestor with Breathe made this book come out, and it's amazing because we talked about we've been soft foods and chewing less, more smoothies, and we've adapted and evolved narrower phrases. I'm like, yeah, so it's coming at us from all different angles, and the
Right.
main point is that like we got to help it because it's here.
Right.
And also, yeah, can we prevent it? It's like, yeah, that's a hard one, but I do love that more people are aware of this issue, and some people have become more aware that they think that's the root of everything. And so my favorite thing to do is like when a 2-year-old mom brings a 2-year-old and the 2-year-old's having trouble with speech, and I'm like, I don't think the tongue tie is the issue, although it can be. And sometimes people don't find out until they have it released, and then they realize, oh, yeah, it was. But I said his hemispheres don't seem to be connecting, as evidenced by the cranial bones being stuck. So I recommended he supplemented with minerals. In this case, I recommended monatomic elemental gold. Gold is amazing for connecting hemispheres. It was like within weeks he was communicating more easily, and that was actually the thing that moved the dial for him. It wasn't going through a surgical procedure. So I just love that, the body is amazing and it can heal. And if we give it the chance to heal, it's so able. And
Yeah.
so, yeah, partnering with our bodies to nurture them, especially when people have been through it, right? They've come to you and they've been like, I don't know what to do. And, I'm curious to know sometimes like, well, let's just say that people come to you and they're like, they've been to so many people and then they find an answer, and it's like they're so thankful. And I mean, so for me, I'm like,
Mhm.
I think anybody out there, if you're like, okay, you're talking about other people, you're talking about, you're like, what's something that, so if and I know we're coming close to our time, but if I could lead people into like a 1 or 2 minute like meditate activation of their tongue to help
Mhm.
loosen things, would that be okay?
Yes, I would love that. I know, I was, like, thinking, "Gosh, I have so many questions. We're gonna have to do a part 2."
Yes. Let's
Um,
do it.
even just, like, I talk about the connection with the mouth and the pelvic floor and, like,
Totally.
even, like, opening up the pelvic canal during birth, pressing the tongue on the top of your mouth opens up your jaw and opens up the pelvic floor, but what if they can't press their tongue up? Like, I was just, like, going down all these things that
Yeah.
but the reality is there are a lot of connections, and I love how you really just described what was going on for people, and we'll do this again. We'll do
Yeah.
another version. But I want you to leave. I want I want the listeners to, because I know you have a client, so I know we have a hard stop. I want the listeners to know how to reach out to you, and I'm going to put information about you in the show notes. But yes, I want you to give people something that right now that they could do to just start be increasing their awareness
Yeah.
and treating any kind of tension, because would you also agree that even though the ties are really common, um, there's also we hold so much tension in our jaw even without ties?
Yes.
Like
Absolutely.
there's so much tension in I know, like, when I am in stressful situations, I start to get earaches because I clench my jaw and it restricts the fluid, plus I swim, so, but, so, like, I know, like, there's so much going on here, that is all connected, so
Yeah.
yes, the
Yeah.
answer is yes. Go ahead and take our
Yeah.
listeners through what you want us
And
to know.
and that reminded me, there's this one person who came in, and yeah, TMJ was her main complaint and issue, and yeah, like her bladder was out of alignment and her uterus, and we released fascia near it, obviously not on it, and it was after that that her asymmetrical like jaw and her palate shifted enough to create relief for her when she had had a hard time having it. But there's other people who have clenching, grinding, and their jaw and their teeth, and it's stress, and it comes from all kinds of you know environmental factors, or even mold toxicity can create like airway issues. Even when people don't have ties, it can create this pattern of rigidity in the body. So, and yeah, I totally want to talk another time, because to talk about the diaphragms of the body, and I know you're totally, the pelvic floor is a diaphragm, and
Mhm.
the belly diaphragm is a diaphragm, and then I talk a lot about the floor of the mouth because it is a diaphragm, and it is so important because it regulates flow. And then there's the cranial diaphragm, and then there's like 15 totals that I love talking about. But yeah, to kind of connect some of it, and just to kind of say, like, what can anybody do, what can you all do to just help find something perhaps you haven't done, even if you've done myofunctional therapy and you've done a ton of like tongue stretches, and some people have done a lot of that too. So it's a little bit of a mindfulness thing, I'll say here. And for those of you that are driving, don't close your eyes. You got your feet on the pedal, whatever. If you're doing any of that, just obviously be safe. But for those of you that can, I want you to kind of find where your feet are. And in a minute, we'll close our eyes. Find where your feet are. If they're resting on the ground, just kind of tune into them. And and then if they're kind of sitting up on the bar of a chair, that's okay. Wherever they're at. If you're standing, that's okay. If you're listening and you're doing laundry or doing dishes or whatever you are, that's usually what I do. You don't have to stop and do this, but just kind of be aware of what I'm saying and feel, if you would, where your feet are touching the ground. And I want you to close your eyes now, and I want you to just let your awareness drop to those feet, to your left foot, and feel where it's touching the ground, the right foot and where it's touching the ground. You can also be aware if it's easier for where it isn't touching the ground, right? And you can feel, are your calf muscles or your Achilles tendons tight? Is your shin or does anything feel tense in your body? Then I want you to now kind of travel from the feet up through the legs. This is kind of with your mind's eye. Up to the feet, to the legs and into your neck and into your mouth. And just kind of now I want you to be aware of your tongue. You might feel the saliva in your mouth. You might just kind of feel it. Now I want you to go ahead and put your tongue to the roof of your mouth. And not just the tip, not just the front, but try to get the back up there. Sometimes creating that sound helps. And if you hear a high pitched sound, that might mean it's the front. If you get a broader sound, that means you're probably getting the back of your tongue a little further up there. And if you can't, if you wonder if you have a tongue tie, kind of forget that for right now. So getting your tongue up to the roof of your mouth, breathe in through your nose if you can, and out through your nose if you can. Good. So there's the breath. Now I want you to take the tip of your tongue and I want you to feel every part of your palate, every part of the roof of your mouth with the tip of your tongue. It's called tongue mapping. You can go from the front to the back, like brush strokes with a paintbrush, and from left to right or right to left, and just cover all surface area of the roof with the tip of your tongue. Just feel it. Now I want you to dive that tip of your tongue down to the floor of your mouth. So you're inside the teeth, in the gum line, but also right under the tongue. Same thing. Feel every area you can in the floor of your mouth with the tip of your tongue. If it's hard, it's okay. Just try. Good. If you can, like push a little harder to gently massage it. If you can't, and if it hurts, don't do it. It's okay. Good. And I want you to then bring your tongue back up to the roof of your mouth. Deep breath in and out. And if you would, open your eyes if you're watching so that you can see what I'm doing. If you want to keep your eyes closed, you can. Keeping your tongue to the roof of your mouth. Then go ahead and open your mouth. But keep your tongue at the roof of your mouth so you stretch your tongue. Feel that stretch if you can. If you don't feel that stretch at all, maybe your tongue isn't up there all the way, or maybe you need to tip your head back a little bit with your tongue stretched. And then if you want to come back to level, maybe you need to lean your head to the left, to the right. In one last movement, we'll go to rotate. Turn your head to the left with that tongue stretched, and to the right, and then back to center. Now I want you to close your eyes again as we finish out here. Come out of that stretched position. Just get the tongue up there on the roof of the mouth. Feel where your tongue is touching the roof. Maybe feel where it isn't, but more feel where it is. And then now, let your attention drop to your feet and feel where they're touching the ground. And just feel then. Be aware of your feet. Be aware of your body. Notice if you feel any changes. But pretty much just notice, because there is no real goal here other than just tuning in. Okay.
Oh, that was good. That was good.
Yeah.
I especially liked the stretch when you turn. Like I was
Mhm.
like, "Ooh, that's where," you know?
Yeah.
That was just bringing that awareness and to their mouth on our own without having anybody else, touching in there or causing pain. It's very we get to be in control of
Yeah.
how much um yeah, and that tension. Okay. We didn't even get to half of our questions, so we'll schedule another time,
Great.
but super interesting, super helpful, and I'm going to put, you do see people remotely, you do see if you're not in the Bay Area, because I have listeners all over the world,
Yeah.
right? So you do, see people remotely,
Yes.
and we're gonna put your information about your clinic and, like, how they can work with you and get more information. And then, also, if you guys wanna comment with us and ask questions that you would like us to cover more on this topic, we would love to do that.
Yeah.
But I know you have a client, so I am going to let you go, reluctantly, but I'm gonna let you go, and we'll talk again, okay?
Yeah,
So
absolutely. If anybody wants to like tune in, it's just look at me on Instagram. If you just Google floor of the mouth and Neil, Neel, like my first name is Neil, you'll find me. And then,
yeah,
yeah, I can't wait to do this again, Kelly. It was so fun. I really enjoyed it. And thanks for having me. And thanks for letting me talk to your people. And I loved it.
yeah, it's good to connect. All right, thanks everybody for listening. If this topic has resonated with you, if you're starting to think, "Oh, I know more about I'm curious about the fascia or about tension in my jaw or feelings that I'm feeling like that have maybe been dismissed, there's a lot of things connected. Your body is very interconnected, and sometimes we have things going on that you might not be able to connect, but will help you connect. And so we want to give you those resources. We want you to be strong for the life you were meant to live. We want you to feel connected. We want you to feel like the best version of yourself, for yourself and for your community and others around you, right? So when you feel your best, you can give to others in that way. So thank you so much for listening. And if you want to find out more, look into the show notes and also at thetummyteam.com. All right. And we'll see you guys next time. All right. Thanks, Neil.
Thanks.
In these conversations, we do deep dives, and resources are aplenty. So please tune in and enjoy. And I'm so excited to have you along for the journey.